Welcome, viewers and listeners, to the COVID 19 update for today, February 10, 2022. Of course, I'm speaking with the Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you for joining us this morning.
Well, thank you very much for having me on the program.
Okay, Minister, can we begin with an update on the vaccination campaign in the hinterland regions?
Well, in terms of the interior, we have continued to offer vaccination at various sites across the interior. And right now in Region 1, we have an 89.1% coverage for first dose COVID-19 vaccine in adults. And second dose coverage would be about 53.9%. So that's Region 1. In terms of Region 7, we are at 85.2% first dose. And for second dose, we are at 60.1%. In Region 8, we are at 53% first dose. And for second dose, we are at 43.2%. Region 9, we are at 77.8% first dose and 59.3% second dose. So these are the areas in the interior, the coverage that we currently have. We have been sending out teams to different areas in the interior locations to administer vaccines, but unfortunately in some of the villages that we've gone to, there is a lot of vaccine hesitancy. And despite going in several times and offering education, it still remains a concern and a problem because people are not taking the vaccines. So it's not a matter of access. The vaccines are available, but because of misinformation, I think we're having that challenge. Nevertheless, this year we have allocated enough monies to continue these campaigns where we'll be sending out teams to do vaccination in various communities across the interior.
Okay, Minister, as we're on the subject of vaccination in these regions, can you say if there's any preferred vaccine there?
No, really, we have offered all the different types of vaccines that we have. We have been offering AstraZeneca, Sinopharm, Sputnik, Pfizer, J&J. Now, J&J is convenient because at one time it was deemed as a single-dose vaccine. However, with new guidance from the CDC, they are recommending that after a first dose of J&J, that you should get a second dose at least 2 months after. So the advantage that J&J would have had, especially in far-off population, no longer holds true because you still have to give a second dose for it to be as effective. And that's why we have offered all the various types of vaccines that we currently have in the country to all of the regions.
Okay. Dr. Anthony, there continues to be a very low rate of vaccination among the 12 to 17 age group. What else can you say can be done then to motivate parents and the children to get inoculated?
Well, one of the things that we'll be doing is a more intensive campaign after the budget. As you would know, the budget would have allocated resources for us. We used to do a lot of drive-thrus and so forth, so we'd want to do some of those to encourage people to come out and bring their child for the vaccine. Hopefully that would help to change the dynamics of things. So that's one of the things that we'll be working on.
Okay, Minister, can we now have our total active cases?
So the cases, as I've said before, we have seen a drop in cases. Right now, the active cases, we have about 3,279 active cases. And over the last 24 hours, we would have seen 212 newly diagnosed cases. So the rate of discharge is much larger than the new cases that we're seeing. So we expect this downward trend to continue And we've also seen a similar drop in terms of hospitalization. As of today, we have 86 persons in hospital, and of the 86, 68 of them are right now at the Ocean View Hospital. 17 of those persons at Ocean View are currently in the ICU, so we continue to monitor them and to offer treatment to them.
Okay, finally, Minister, can we have our current vaccination numbers?
Well, the vaccination numbers, as I've said, in terms of the national numbers for adults 18 years and over, we have 427,680 doses that has been administered. This is first dose. That would account for about 83.4% of our adult population. And for second dose, we've had 320,221 doses. That would be approximately 62.4% of the adult population. Boosters, we have administered so far 44,282 booster doses, and the 12 to 17 remain pretty much the same. We probably had about 100 doses administered yesterday. So we still have to do a lot more work with that age category. And as I've said before, we are going to try to work out some more innovative ways of reaching that age group.
Okay, that brings us to the end of today's COVID-19 update. Minister, thank you for joining us.
Thank you very much.